That was amazing. That was so amazing. So amazing. We don't always know what's coming. We don't always know how we're going to be able to address the issues that we have. Sometimes we don't even know that we have issues that needed being addressed. And I'm the kind of person who doesn't really like going to the doctors, or I haven't my entire life. And this year, I also had surgery for the first time, which was a totally new experience. And I'm 2 weeks post-op and I feel really great. And now, as soon as that was happening, I found out about the tongue tie and I'm diving into this myofunctional therapy. And if you know me personally, you would know that I don't regularly go to the doctor. I had a feeling last year that I should just establish with a primary care provider. I hadn't been to the doctor in a long time. And honestly, I had been gaslit by previous male doctors telling me that my period pain didn't mean anything and that I should just take some Advil. And when I told him I think I might have endometriosis, he actually got all serious and went who's the doctor in this room? I did have endometriosis. I also had a cyst on my ovary. I did not find out thanks to that doctor. And my primary care provider that I started seeing got me diagnosed with mold illness. So this has been a huge year of healing for me. And I was a little nervous going to this first appointment. And my main point here is trust with your doctor is so important. So that was on my mind going into this appointment. Needing to establish that I feel comfortable doing therapy with the person and following their recommendations, because that can be really hard for me. If you don't like somebody that you're working with, go get a second opinion. Go find somebody else. You do not have to keep working with them. I'm going to find out today. Today is my first actual myofunctional therapy appointment. So today I'm going to find out a lot of different things. So what I want to talk about in this episode is how I'm going to assess my provider. And today I'm going to see them. So we'll get to do the assessment. I'm recording this before I'm going. And thank you everybody for watching the first video. The first video I'll link. I'm shocked that people watched it. Sometimes you put something out there and I talked about this, you feel like nobody's going to watch it, but I have 13 subscribers and 150 views. And to me, that's if I were to talk in front of 150 people in a room, that would be amazing. I know to some people that those metrics are really low, but the way I look at metrics is that, each one of those people, if there's somebody who's actually interested in what I'm having to say, that's amazing. That's totally amazing. It's been really awesome and I'm excited to keep this going. I'm making weekly videos for you all about my journey, finding out about my tongue tie and working to heal that tongue tie. Starting myofunctional therapy, probably going to get the tongue tie released. We'll see what my therapist says today. But today, before I go in, I want to talk about what I'm looking for in a therapist. Mainly, I'm looking for competency and connection. So for me, if I can have those two things in a provider, that's my idea of somebody who I'm going to work really well with. Competency. So how were they recommended to me? Were they recommended? Do they have people who said this was good? That is how this happened. I found them through a recommendation from a friend who had their baby's tongue tie cut with this person. So I don't know about their work with adults. I'm going to be asking them about that today. I also found them listed there's a California tongue tie Facebook group, and they were listed. There's a Google Doc there with providers in California, and I saw that they were listed there, so I'm assuming that's a recommendation. This is their website. It's mychicodentist.com. This is Brooke Edgar, the myofunctional therapist. Loetta Robles is the main provider who does the fractotomies. They have this great information, some clinical information. I would recommend checking them out if you're in Northern California and looking for this work. I'm going to ask them about their recoveries and like how the recoveries have been for other people. And I am going to ask them about like what's their kind of like protocol with recovery, because that's where I've seen it being a little bit different. And I want to know how many of these fractotomies, the cutting of the tongue ties, that they've done. And I want to know when was the last time they did it, and if they do laser or if they cut, and if they suture, if they don't suture. And I'm not fully versed in those details, but I know enough that I want to know to ask them those questions. And yeah, like in general, what is the recovery protocol? So what are the experiences that people have had with them? Have they recovered well? Have they not recovered well? Have they had to get them cut again? Yeah, so that's what I'm looking for with competency. And in general, like, I also then want to feel connection. So like, like my body, is it tense when I'm there, or am I relaxed when I'm there? Are they personable? Are they listening to me, or are they gaslighting me like that doctor I talked about? Are they somebody who like I feel comfortable sharing with? Are they somebody who I feel like is going to understand my concerns and work with me on my concerns and not pressure me into doing things that I'm uncomfortable with? Those are what I mean by having a connection. So yeah, I'm excited. I actually have to drive and go there now. So hey y'all. So I just got to my appointment and I feel like tightness in my throat. And I have just been feeling like this is big. This is big. I could go into that office and she could tell me like, actually, I don't think that you have what the person online said you have. You're not a candidate for this. I would get a second opinion if that was the case. But I'm realizing that I never thought I would be in this position where I am seeking so much help from the Western medical institutions. And it's not like I have a feeling that I'm unhealthy. I actually think I'm really healthy. It's just that there are these things that I never thought were problems before that I'm realizing I could probably do something about that. This is like really unexpected for me to say, oh, okay, I'm gonna go see this expert, myofunctional therapist, orofacial myofunctional therapist, and like go into their office and I'm gonna do what they tell me to do and like do exercises for my tongue. So I am just like wrapping my head around that, like me 10 years ago versus me now, and how I'm navigating learning about this tongue stuff. I'm going to pay $150 today for the diagnostic consultation, and they're going to measure my mouth and she's going to give me her treatment assessment, and I'm going to learn a lot more about it today. And, I'm really here to assess her. Like, is she competent? Do I connect with her? Do I feel like this is the place I want to do the therapy with? But another reason I'm here is because it's affordable for me. Because they bill as medical, I am going to pay that $150 out of pocket for the consultation, but then I'm going to get back like 90% of that once I send it to my insurance and they're going to reimburse me. Same thing for all the therapy sessions, which I can do those virtually. This one they want me to come in for. But I know you can get assessments and do this completely virtually, but also it's nice to make a connection with somebody in person. So I'm glad I can do this in person. It's only 30 minutes from my house. And the surgery, which they also do here, there's like 2 practitioners here and they work in tandem. They cost, it's like $950, I think they said on the phone, but that again is going to be 90% covered. So I'll end up paying like $90. And I figured all this out because I called my insurance, I called Blue Shield, and I talked to them, and the lady on the phone, she wanted codes and I didn't know codes, and so I just said, here's the office I'm planning on working with, and she called that office and talked to their receptionist and got the codes and found out that this office doesn't bill as dental. I do not have dental coverage, and I'm going to a dentist's office right now. So the reason I'm getting this covered is because they bill myofunctional therapy as medical, but they're not a medical office, so they can't like charge me a copay of $10 or whatever. They have to bill me, and then I have to go to my insurance and get that reimbursed. So that's the deal with this. I'm excited. Okay, I gotta go in there. That was amazing. That was so amazing. So amazing. There's so much I want to process. I just did sleep diagnostic and myofunctional therapy consultation back to back. My myofunctional therapist said I have a tongue tie, I have a lip tie, and I have a cheek tie. So the process can have more than I thought. Okay, I'm editing this, and I just wanted to say I inserted those cheering noises because to find out that there could be like something wrong with you when you aren't quite sure, but you think maybe, and you think maybe that's going to help you and it's going to create a path for healing for you, is so amazing. So yes, I got my diagnosis. Also, I have tape marks on my mouth from sleeping with tape on my mouth to get the experience of breathing through my nose all night. I love the woman I'm working with. My brain is spacing on her name right now. I'll put it down here. I love her. I'm really grateful that she's the person that I found. She seems incredibly competent. I have a very strong connection with her. I got to ask her all my questions about their record and stuff, and it seems like they're really good. I know that she's connected with the Breathe Institute, and the Breathe Institute is like time and time again the place that has like all the really good information about airway and tongue tie and all that kind of stuff. So I'm feeling like high level of I'm in good hands. So whew, that's like a big relief that I don't have to like go find another therapist, or I have this feeling of like meh, because I have had that. I told this woman about being gaslit by doctors before. She was saying that it's really hard for people to stay motivated doing tongue tie, that's a big issue for people who especially are adults, and they're like, well, why do I need to do this if I have lived my whole life like this? Like, I'm fine. And I think one thing going into this that's like working for me in my favor is that I have never been someone to take my conditions as a sentence. I've always been someone who feels like the body can heal itself, and I want to prioritize doing non-invasive, sometimes they are labeled alternative or complementary things, but to me they're what modern medicine should be promoting and doing. And then we would use modern Western medicine, when all else isn't working, because it's awesome. Surgery is awesome. Emergency medicine is awesome when you need it. And I feel like a lot of people, they get into this habit of like, well, somebody should be doing this for me. Like, I should be able to take a pill. I should be able to just like, it should be easier. And one of the things with myofunctional therapy is that I'm going to have to do these exercises. I'm going to have to stay committed. It takes work to retrain the position of my tongue in my mouth. I am going to have to build new neural networks. I'm going to have to reprogram my brain to speak differently, to swallow differently, to breathe differently, to rest differently. All of it. It's going to be a huge process, and somebody has to be willing to go through that. And if you don't understand the connection, if you don't fully believe that it could be like causing you to be tired because you're not sleeping properly, because you don't have airway, your airway is obstructed, if you are not able to concentrate and you'll have like ADHD symptoms, but you're not realizing that that could be because your tongue is like pulling all your fascia in a direction where you can't sleep and rest properly, or you don't feel like it's connected to your like body pain or your joint pain or your jaw pain or all the different things. If you watch video 1, I talk about all the different symptoms. I can see why, if you're like just being told by your dentist, oh, I think you should look into getting your tongue tied, you might think, why would I do that? Why would I put myself through all that work, all that suffering, have to get surgery, have to recover from surgery? I'm not gonna be able to eat food for a couple of days. Like, it's gonna, well, eat the food I like to eat. It's gonna be painful. Like, why would I put myself through that? So I'm really happy that she mentioned that. It's giving me some perspective for other people who are going through this. So yeah, that's my, I just did it. I just did it. I have a tongue tie, I have a lip tie, and I have a cheek tie.